Hey, Nerve Spa family. I am here with Dr. Andrew Fetterman, Creative Health and Spine. And today we are going to be talking about one of our cooler products, the NerveWave. And Andrew's been good enough to jump on a call here and
Mhm.
pretty much tell us, what he likes about it, um, clinical feedback, patient feedback. So you've been using the nerve wave for what about month and a half or so in clinic, actually in
Yeah, about
clinic.
6 weeks. Yeah.
And just see if I can do this on the Zoom call just to give everybody an idea of what the product looks like. Added benefit of that is it covered my face. But sorry about that. I just didn't wanted to do that for I forgot. But you've been using it for
Yeah.
about a month and a half or so in clinic. Now there's multiple programs
Yes.
on the Nerve Wave, but which ones have you been kind of leaning into?
We've been leaning into with the multiple disc patients and chronic pain patients that we see. We've been dealing with the regenerative programs, protocols on that end, and then also restorative programs. So I like the regenerative ones more for my acute patients. Say they hurt their back or they sprain their SI joint. I really like it's a little bit of a softer feeling from a sensation for a patient standpoint.
Gotcha.
Very good for repetitive stress as well. I actually personally about an hour ago used the regenerative protocols for the joints for my own forearms because I was dealing with some tendonitis from carrying my 2-year-old who's a bowling ball and shoveled about a foot of snow for about 3.5 hours this morning. So my forearms were on fire. I did a session with that, and it feels like nothing changed. I mean, like they're perfectly fine, actually better than good.
Oh,
So,
sweet.
phenomenal protocol. So, I mean, like I said, personal use myself, but a lot of my disc patients, my chronic pain patients, we've been bouncing between the two of those, depending on personal preference and also what we're trying to gain out of the patient session. Sometimes we've been going a little bit shorter than the full protocol because we're already getting benefits from a shorter protocol from time to
Right.
time. Not all patients, but for some. So there is some versatility there with utilizing the protocols from a clinical sense. So you don't have to just do what's the presets for that. So
Nice.
we use a lot of the Nurse Spa products as well for neuropathy patients. So we haven't used that as much for our in-office people because we do more telemedicine on that side. But phenomenal results so far, and we feel that we've gotten patients to calm down a lot better than any kind of STIM protocols that we've used before with our patients.
Naturally, another one of my loyal brethren is calling me, but
Yes.
couldn't have set that up better. So, is it safe to say that the patient outcomes and the patient feedback has been good, or am I putting words in your mouth?
No, it is safe to say because I feel that we're getting better results with what we're using here than the standard STIM units and TENS units that we've been using with patients. The unit is very easy to use. It has a lot more. It has more of a dynamic a sense to the fact that you can go from 0 to 100, so you can really tailor it a little bit more to what the patient's feeling and what you're also trying to accomplish. So, with also the fact that you do multiple areas, I mean, basically, you've got four leads running out of the thing. So, you have four different areas you could be treating at the same time. And with some of my chronic pain patients, it's upper back, it's lower back. They're even down the legs with sciatica. So, sometimes
Mhm.
we add some other therapies further down the line. So, we're able to trace different patterns and different neurological points with the patients and are getting great results with it. So,
Oh, sweet. So let me ask you this,
mhm.
and tell me the truth. Um, in terms of ease of use, what are your thoughts on that?
Oh, it's very easy to use. I love the fact that it also has the option that you don't have to have it plugged into the wall because that is huge for us because we have an open base style treatment room. So we have multiple places we put it. So sometimes it's on the windowsill, sometimes it's on a stool next to the patient. It's a lot better than having it plugged in all the time. So, I mean, yeah, we plug it in from time to time, obviously, to charge it. It runs a lot of sessions without needing to be charged again. So it can easily go through a full day with basically running 10, 15 times in a day without it being used to recharge it for the way that we utilize it with our patients. And
Oh,
then
that's
it's like
cool.
plug it in at night and go about it. It's a lot easier. There's no cords to trip over, especially my dog running around the office. So he likes to trip over everything and run into things. So
Hey,
it's like
careful
we don't have
now.
to worry
We
about
at
that.
Corp, let me tell you, be careful what you say about your dog. We at corporate are avid dog lovers. Just an aside.
Yes.
So,
Yeah.
so let me ask you this. There's this thought of this, Andrew. Do you have any other, I guess, what would constitute a clinical, stim unit in the clinic, or
We've been using the clinical, the Ultima Pros from Nerve Spa for most of our patients where we
well, I
utilize
guess I
that.
mean like, something a little more on the higher end, like Synexus or something like that. Do you have any of that kind of stuff? If you
To
don't,
be
I'm just
honest,
curious.
we no, we don't, just because I felt for, I mean, from a clinical outcome standpoint, with all the different therapies that we do in the office, it's a very expensive piece of equipment to put into the office for what we're doing. And I know how things have changed in the neuropathy world when it's come to those units and reimbursements if you're working in some kind of integrative clinic or
Mhm.
multidisciplinary. So it's something that we haven't really utilized. I've tested them out and they do really well, but I
I
feel
was
that
just
this
curious,
is on the
how
level
the
with it.
NerveWave, if you had one side by side. But I mean, I think,
I wish.
I may I may be, putting words in your mouth, but now you don't have to. It seems like
Yeah,
the NerveWave has kind of filled that need without spending, a small fortune.
right.
You've got the NerveWave, which is seems to be filling that need at literally a fraction of a fraction of the cost.
Oh yeah, absolutely. 100% agree in that. I mean, that's what we felt when we saw when you first showed me this piece of equipment and what it was going to do, and I automatically jumped to the Hakamed Neuromeds and the Synexus units and going exactly what they're saying they're doing. I'm like, this thing should be right on par with it, if not exceed it in different ways. Just because, like I said, I love the portability and it's light. We can move it around the office real easy. You don't need a big treatment cart to do it for us. And I take the unit home for myself if I need to. And it's pretty easy. You don't have to worry about charging it or anything like that because, like I said, the battery runs really well with it and still delivers an amazing experience and treatment.
Yeah, I mean, I tend to try not to be one that just sells on price, at least out of the gate. But it's kind of cool that the Nerve Wave is stacking up rather favorably to these other products, and literally, you know, half a third of the price
Mhm.
at worst, right? So I guess I guess to put a bow on it, so to speak. Um, Sounds like you just have nothing but good things to say about the
Yeah.
nerve wave, mainly because that's the truth. You're easy to use. Your patients have been seeing very positive outcomes. Um, if I've said anything that doesn't jive with what you're going to tell me now, but
No, I mean,
sounds
I
like
think
this has been
also
a
what's
home
nice
run.
when when we explain it to the patients, especially like I said, a straight marketing patient understanding standpoint, is you say nerve wave, they understand it's working on their nerves right out of the gates. They understand that. Where you like, Hakamed, Neuromed, Synexis, they're like, that's Greek to me. So say, hey, this is called a nerve wave. It's a higher end level of electrical therapy and it's going to change how your body responds to things. And they're like, okay, let's try it. It's a lot easier for patient compliance too to say, let's try this. And, we're getting great results with it. So, that speaks for itself. So my therapists and staff, they're even putting it on some of our regular patients as well to just say, hey, let's do this. And they're like, I like that. That's smoother and it feels better than the other stim units we're using. So we're probably going to be incorporating it with all our patients on a regular basis to some level to work on
Well,
breaking up tight muscles and just getting them to relax better.
well, you know what? I think that would be an unbelievable place to for me to stop talking and asking questions because you've said it about three or four different ways that the nerve wave is just a real good piece of equipment, and you guys are getting great results. So I don't want to run the risk of over talking the point because you said it all, my friend. So
Yeah,
thank you for the candor and for the
absolutely.
partnership and for the feedback. And
Absolutely.
without any further ado, thanks for the time.
No problem, Scott.